We're joined by Secretary-Designate Dr. Tracy Collins for the New Mexico Department of Health and the Human Services Department, Secretary Dr. David Scrase. We have a series of slides to share, and then after that, we'll take some questions from members of the media. I think with that, I will mute myself so we can start with Secretary Collins.
Alex, I think I was going to do this first slide.
Yeah, go ahead, David. That's great.
And then I'll have Tracy join us. We've got cases for the day, 1,272 new cases, and a running total, as you all know, 132,075. That puts us over the 6% of our population having been infected, which has been going on this week. And you can see that our hospitalization count at 810 people. And if you've been keeping close track, you'll know that's lower than it's been in some time. And we are getting our first break in the hospitals in over 4 weeks in terms of declining hospital volume. It's been a relentless curve upwards. We have 158 people on ventilators, though, which indicates very, very serious illness. So we are watching that closely. And I do want to make one point too on the hospitalizations as well, and that is that this relief that's happening in hospitals is not happening in the Northwest. They are still seeing high case counts, and while the curve is flattening there a little bit, we don't expect them to get that same relief that other hospitals in the state are seeing, probably for another 7 to 10 days. And then lastly, we had 23 additional deaths yesterday. This is the hardest part of the press conference to talk about that. Over 2,200 New Mexicans now have lost their lives to coronavirus. Over 2,200 empty places at holiday dinner tables, and our hearts and holiday thoughts and prayers go out to those folks who've lost anyone during this pandemic, but particularly those families who are losing people over the holidays. As a physician, as a geriatrician in particular, deal a lot with families who lose loved ones. And when it happens around the holidays, it's something that comes up every year throughout, for a long, long time, that sadness of this moment right during the middle of the holidays. So with that, I just want to go over those cases. If there are questions, we can take them later. I'm going to introduce Secretary-Designate Tracy Collins. I just can't tell you how delighted I am to have her here. Not only did she hit the ground running from the first day in the job, but from like 30 days before she started. It's been great to have somebody I can text at all hours of the day and night to check on things and coordinate things again. And it's just a real pleasure to have you here, Dr. Collins. And I think with that, we're going to go right to your slides.
Thank you, Secretary Scrase. Can we advance the slides? Thank you. So I want to present a vaccine update. Next slide, please. So fortunately, New Mexicans are receiving the vaccine. We know that hospital workers are receiving the vaccine, and we've distributed, our shots in arms have been greater than 14,000 to date. We're now expanding to larger groups of healthcare workers and long-term care facilities. So we are very happy that vaccine is going throughout the state, rural and urban communities. Next slide, please. So some more good news. We are launching a registration app today, and it is open now for those in phase 1A. And you can go to the website that's noted here. You can sign up and you'll be notified when you're eligible. So basically, if you're eligible now, you'll learn where to get the vaccine. If you're not eligible, you will receive a notification when you are. Next slide, please.
Hey, Tracy,
Yes.
Before you go off this slide, I think it may be the case that actually anybody can go and register, like pre-register now, not just 1A people. That if you go in there, you can sign up, and then when your category comes, you'll be notified.
You're right. You can go to the site now. You can put your info in, and if you're 1A, you'll be given more information now. But if you're not, we will notify you later. So it is open to everyone, but the folks who are going to progress through the website will be those who are in phase 1A. Thank you. So after this phase of vaccine distribution, 1A, we will provide more information. So we're now looking at 1B and 1C, and we've actually received recommendations from the federal government on how to proceed or prioritize these next groups. But we're going to consider what they recommend. We're also going to meet with our medical experts and community members and have them weigh in on how we should prioritize. We're certainly going to be considering the New Mexico workforce and the total impact of this pandemic on our state. So more information on eligibility will be available in early January. And I believe that's my last slide, or do I have one more? Oh, here we go. So at-home testing. So more good news, this is great. We are partnering with Vault to offer free saliva tests. These are at home. Your results will be returned within 48 hours, ideally 24 to 48 of receipt of sample. And what you need to have is you need online access to Zoom. You'll receive a test at home. You'll self-administer the test with a virtual supervisor. Then you'll mail the sample back for processing. And this is all free. Now keep in mind, you'll be asked for your insurance, but you're not required to have insurance. It is free. And there's a link that you can go to learn more. Next slide. Okay, back to you, Secretary Scrase.
Yeah, thank you. We're going to do just a couple new science articles just because they are current, and some of you have already asked us questions about them. A new paper from the Journal of the American Medical Association. We previewed this concept for you, I think, in the summer when coronavirus was the 5th or 6th leading cause of death in New Mexico. Nationally, it's moved up to 3rd now, behind heart disease and cancer. We are, I think in some ways we can become numb to the number of people dying. That the current mortality rate is the same as if we had 15 Airbus 320 jetliners, each carrying 150 passengers crashing every day. This is a significant loss of life. And CDC is following this closely, but sometime in October, because there's a retrospective component where we have to look back, sometime coronavirus became the 3rd leading cause of death for everybody over 45 and the 2nd leading cause of death for those over 85. And we've also talked about excess deaths, which is a concept that's new to many of us, the idea being that when you're in the middle of a pandemic, you see increased death rates for other diseases that aren't necessarily tied to COVID. All of our COVID reported deaths are deaths that a local physician, a treating physician, lists as the cause of death on the death certificate. But in addition, New Mexico's already seen an increase in deaths from Alzheimer's disease and other things. And there's lots of theories about this. We don't have answers just yet as to what pushes that, but obviously our delivery systems are under significant strain, and that could potentially be a factor. CDC is saying right now that excess deaths are about 20% more, 20% in addition to what we're already seeing from COVID death counts. So a significant number of deaths in New Mexico. That would be an additional 440 people using that 20% estimate from the CDC. Okay, next slide. Another a bit of information in the news. I wish I had a journal article to rely on to give you more information about this. This is mainly coming from our epidemiologists and other folks participating in conferences with the CDC. You've read about it in the newspaper, but the first thing before I get into this mutation is that viral mutations are normal and they're expected. If you think about influenza and the 102 years we've had since the Great Pandemic in 1918, there have been very many mutations of the influenza virus. The vaccines are updated every year Flu vaccines are updated every year to account for changes in the virus and changes in the most popular, if you will, influenza viruses circulating in the world. And so there's a very detailed system used for this. So no one at all is surprised that there's a mutation in the virus. There have been many of them already. When we do the analysis of the RNA of these viruses, we see lots of different strains. But this is unique. It has 17 mutations at once. And this may have occurred during a long infection of a single patient that allowed that virus to evolve inside a human host. The reason we think, and you've seen a lot on the news, that this is much, much more infectious than the regular coronavirus, not really sure that's even true. These different strains kind of come and go in the population, but this one did, when it was first identified, they found out it was about 26% of all cases in London in late September, and by mid-November, it was over 60%. So it certainly is more common. We don't know if that indicates increased, what we would call R0, the reproductive number of a virus in an unrestrained, unprotected population. We don't have that data yet, and we're watching for it. We don't really know if this disease causes more severe illness, more hospitalizations. We don't know whether it actually is resistant to the vaccine, but most of the world's experts suspect that's very unlikely because the vaccine targets different aspects of the spike protein. So we will keep you posted. No reason to panic. The CDC has a surveillance network already set up many years ago in the United States. Samples go to the CDC, and we will know more about this as the weeks go on. Next slide, please. I just wanted to update everybody on monoclonal antibody treatments. On the bottom here is a graph of the number of doses of bamlanivimab that have been used. That's the first antibody that came out. You can see it's been running about 20 a day statewide, as high as 39 on one day. Just a reminder that our hospitals are really, really busy right now caring for those 120% of normal, of capacity patients that they have, and also vaccinating their workforce. So we're anticipating a little bit of delay as they get through that, as we get down the other side of the curves that you'll see in a minute. We think this will pick up more. The other combination, casirivimab and imdevimab, lagging a little bit further behind. Two drugs have to be mixed, and so our systems are trying to get bamlanivimab up and running. And we are giving messages and information to community physicians to contact their delivery systems to find out, because again, just as a reminder, people over 12, people with symptoms, people with a risk factor can reduce their chances of ending up in the hospital or back in an emergency room by 75%, or by 3/4 is probably a better, easier way to say it, through using this vaccine. So we continue to get it from the federal government. We are ramping up, hope to see more progress after the holidays. Next slide. Here are epi curves. You're very familiar with these by now. The blue dotted line is all the cases in the state. I think everybody involved in fighting the pandemic agrees that we are now on the downside of the curve of this third wave, if you will. Certainly this third wave made the other waves look really, really tiny in retrospect, but our 7-day rolling average with a 6-day lag, so going back to 12/16, is 1,143 cases. And one of the ways we know that we really are on the downside of the curve is hospitalizations, which I'll show you in a minute. But you can see, if you look closely, that really all the regions are on a downhill course except for the orange one, which has been pretty flat. That's the Northwest. And so they still are experiencing a high case volume. Their hospitals are still experiencing a lot of cases. If we go to the next slide, we'll see this is just daily hospitalizations across the entire state. And yesterday we were down to 796. I think it's 810 today, but clearly down from the high 900s where we were before. Next slide will show you that relationship that you've come to know and hopefully understand between cases, followed a couple weeks later by hospitalizations, the purple line here today, and you can see that is taking a downturn. And then about 2 weeks after hospitalizations take a downturn, we're hoping to see a downturn in deaths. I can't say the curve that you're looking at just yet represents a downturn. We'll see that probably over the next 10 days. And then that downturn in hospitalizations that I showed you, I think it's a purple line there, that labeled 859, that's what's not happening yet in the Northwest because their cases are not taking a downturn. When they do, we hope to see that decline in hospitalizations as well. Next slide, please. This is just a daily count that we did yesterday. You can see we had 25 ICU beds that could accommodate COVID patients yesterday. That's cutting it very, very close and about the same as it's been overall. But you can see that our general medical beds now are 133. That's been down in the 50 to 60 to 70 range for a week or two. And that includes the, well over the 100% occupancy that many hospitals are having. And so we are seeing an easing up, particularly on med-surg beds. Lots of people on ventilators, though. ICU is still quite tight. Next slide, please. You'll see here the crisis standards of care. And the MAT evaluates this every week. They evaluated it this morning. Because of this decline in hospitalizations and the easing up, it has dropped a little bit out of the red range into contingency level. We may talk about this a little bit more a little bit later, but we really believe we need 2 weeks of being out of this red zone to say we're out of crisis. We don't want to be in and out every other week. And second, after those 2 weeks, we want to see case counts coming down. But this is something that the people in hospitals are feeling. Another thing, just to let you know, thanks for all your support for people who work in hospitals in New Mexico. The advent of the vaccine has been a huge emotional lift for our hospital workers. I got a Christmas card that quoted a French Christmas carol, "O Holy Night," and there's a line that says, "A thrill of hope, the weary world rejoices." And that's what's happening in hospitals as people line up and sign up to get their vaccines. Last week, a reporter asked, "Gee, are we having a lot of healthcare workers refusing the vaccine?" And our hospital leaders this morning told us that they are just every appointment slot for a vaccine is full. We'll know in another couple of weeks if there are people who don't want the vaccine, but it appears that there's a very, very high enthusiasm and uptake for the vaccine among healthcare workers, which is very helpful to preserving that workforce that's been through a lot of struggles in the past couple months. Next slide, please. There is a grading system. I'm not going to spend any time on this, mainly because I'm too old to be able to read it, I think, on my laptop right now, but it is available online. This is the scoring that was done this morning. The red are those categories that fall clearly in crisis. The orange are that advanced contingency level, and yellow are sort of a very lower level. And you can see we're predominantly there. We'll see where we are over the next couple of weeks. But this is available online under the gating criteria, under the hospital capacity, if anybody's interested in looking, which is why I have it here today. Next slide, please. Just wanted to reinforce, and this is where I put on my Secretary of Human Services hat a little bit, that we still are seeing much, much higher case rates in those areas where there's a lot of poverty. So we can't measure this by individual people's incomes, but we can by census tract. And just for you folks who don't speak epidemiology, these case rates per 100,000 people, which is what you're looking at here. If you just put a decimal point in where the comma is, that tells you what percent of people so far during the pandemic have had it. So far, 8.5% of people who live in a fairly high a census tract with a lot of people in poverty, 40% or more, have gotten COVID, whereas in a very high income or low poverty area, it's about 2.6%. So you're more than three times as likely to get COVID if you have lower income or live in a lower income area, but we believe that's a surrogate for having a lower income. The next slide shows that in addition, you're much more likely to be hospitalized living in that census tract. It's 2.25 times as likely to be hospitalized. And then the final slide, again, if you live in a low income area or you have low income yourself, about 2.8 times as likely to die from coronavirus as someone who lives in a high income area. New Mexico with third lowest income in the country, and I think the most people by percentage living in poverty. This is a really significant issue for us and one we need to keep in mind as we go through all the different algorithms we're going through for vaccine distribution and essential workers and the like. We've presented data before that essential workers are more likely to also be low income workers and therefore at greater risk. Okay, next slide. And I think we're getting near to the end. The gating criteria, we're starting to see some good news here. The spread rate, the transmission rate of COVID now below 1, which by definition is what you see when you're coming down the curve. You're having less cases, which means that the average person is spreading the virus to less than one person, which is why the numbers come down over time. Our case count still quite high, 6 to 7 times where we'd like them to be, but we're getting a nice exponential decrease in the curves I showed you. So there's a hope for the weary world there as well. Testing, Tracy and our team doing an amazing job continuing that. We're hoping that the vault testing will enable us to get over 20,000 tests a day, perhaps over the next 3 to 4 weeks. Working with other vendors has boosted our testing as well. Test positivity rate still high. We hate to see it over 5%. It's been high now for over a month. It is coming down. So 12 is an awful number compared to where we want to be, but a great number compared to where we've been over the past couple of weeks. So that's good news. Still keeping up with contact tracing. We've hired a lot of people since the beginning of this, and we have enough people now to, I think, handle about 1,100 cases a day. And then the hospital's still up against it. They have 290 regular ICU beds with 348 people being given ICU care. They're not doubling up, but converting other rooms. And so that's where we're at there. And then just some interesting data I wanted to show you to close on mobility, I believe is what's next. No, not yet. A couple of things on nursing homes. I wanted to tell a story about that. The blue line is nursing home test positivity rate. That's the number of actual cases, individual cases divided by the number of tests. And you can see at the beginning of the pandemic, very high case rates and high test positivity rate in nursing homes. That 40% means, 40% of the people tested were positive. But you can see that through visitation restrictions and a ton of stuff that Secretary Hochram Lopez has done to really try to make nursing homes as safe as they possibly can be, given the situation we're in. It's a pretty dire situation, given the vulnerability of nursing home patients in general and older people in general. You can see that test positivity rate in nursing facilities has stayed down for the most part below 5% since July. And so that's a great accomplishment, and my hat off to Katrina Hochram Lopez for spearheading that effort. And the next slide, Alex. Let's go back to the previous slide. I just want to stay on that for just 1 minute. I had a patient of mine die in a nursing home this weekend of coronavirus, and he died on a Saturday night. His wife, I happened to see her for a visit on Monday, which is yesterday. And as you might imagine, she was very emotional about the death of her husband. But she told me a story about it that I found very moving, and I just wanted to let you all know about it. I'm looking up the name of the nursing facility because it's important. It was the Garden Retreat in Rio Rancho. And what she told me, and she described her husband's death there. He died from coronavirus, but that, they had done a video conference with her in the middle of the night, and the nurse had got the camera set up, and they had some headphones so he could hear. He was not particularly responsive, but many people, including me, feel like whatever you say the people at the end of their lives has a way of getting through to them, even if they don't appear to be responding. And they got to talk to him. She did, her daughter. He eventually passed early in the morning, and she mentioned they left the camera on for another 20 minutes. And she was talking about it as though she were there. And, you know, she wasn't there. And none of us want to die on Zoom, you know, in a nursing home. But she felt really connected to her husband at that moment, and really felt and wanted to thank those nurses who went way out of their way to allow that to happen. And while it's a sad story, at the same time, my patient will do a lot better, I think, in her grieving process. She doesn't have to go through that denial phase and anger. I think she had already kind of started off ahead of where she would have been had she not had that experience. So I wanted to thank those nurses who took the time to do that. It was a wonderful thing for her. Okay, let's finish this up. Mobility, as you can see, trending back up. I don't like that very last part of the curve. The dotted line is sort of the average mobility. It goes low every Friday, Saturday and Sunday, and spikes back up during the week. But it is trending back up, but we know mobility connects with and predicts cases. The next slide is a really interesting thing that the New York Times put together and basically what it says is, how much did people leave their county this Thanksgiving compared to last Thanksgiving? So what you really want, like if you could have it, we want all of New Mexico to be dark blue. Sandoval County, which sort of stands out as one of the dark blue ones where I live, is dark blue. And I think the other is San Miguel, where Las Vegas is located. Much lower mobility than last Thanksgiving. But if you look more closely, almost the whole state is blue. And the only places that aren't blue are the most rural counties. And so we did well over Thanksgiving. And I just want to thank New Mexico for that. We think that drop that we're seeing in cases is related to the reset and people being careful over Thanksgiving. And we really want to thank all of you. The next slide is another interesting compendium of what's going on with cases around the country. You can see the states are kind of lined up according to where they are on the map, although they're all little squares. And if you look on the East Coast, you see these cases are the week before Thanksgiving, and then 2 weeks. So 2 weeks before Thanksgiving and 2 weeks after. And you can see on the East Coast, almost all the states are in an upward trend, and even the Midwest, an upward trend. When you get to the mountain west at that North Dakota down in Nebraska, you can see finally some decline that I know they've been waiting for. But look at New Mexico. We did have a rise in cases right up to Thanksgiving, but one of the sharpest declines that was seen in the United States. So again, great job to everybody watching and to everybody you know who took care over the Thanksgiving holiday and allowed us to see this decline in cases. And I want to thank you on behalf of every single person who works in a hospital, because they, except for the Northwest, the relief that they're getting is noted and really appreciated. Okay, I think we might have a last slide. So the reset worked. You know, we're a little nervous about the Christmas holiday. If we can get the same results over Christmas and the winter holidays that we got for Thanksgiving, we'll be in much better shape for some things we'd like to do in the new year. And so just asking folks to hang in there. You know, in my own head, we're about halfway through this, although I'm really starting to think that the second half of this is not going to be anywhere near as bad as the first. Maybe the next few months may, but as more people get vaccinated and we learn how to the drill on these things, and we're testing folks in businesses and other places as soon as a case comes up, we're doing better. And so stick with it, New Mexico, stick with us. All those things like wearing a mask, 6 foot distancing, washing your hands, avoiding mixing of families even this holiday. And next year we'll have a especially gratifying celebration. I know some folks are doing Christmas in July and have built that in their plans. Other people will just go out of their way to really enjoy Christmas next year. But thank you all for everything you've done to get us these results. And I think at this point, we're open for questions. Secretary Collins and I, and Alex, I think, is keeping track of who's asking them. And Alex, you're on mute. If you're
I'm here. Thanks, Dave. I was just getting my bearings together. So we're going to take questions from Julia Goldberg and then Matt Grubbs, followed by Dan Boyd. Julia Goldberg is with the Santa Fe Reporter, and you should be able to ask your question. Go ahead.
Thank you, Alex. Thank you, Secretary Scrase and Collins. I had a few questions from the modeling report today from Lanel that I was hoping you could just help me understand. The first does relate to vaccination, and I assume it's based on the modeling that Dr. Devai and other at Lanel are doing. It seems to indicate that, and I might not be reading it right, I'm trying to ask a question. It seems to indicate to me that it looks as though they are saying that the fastest way to seeing the best effects in New Mexico would be to do a sort of cross-check between some of the geographical hotspots and other demographic contributors to risk of transmission. I'm curious how that would work with that new app, which I signed up for while you're talking, Dr. Scrase, but not while you were saying anything super important. And it just asked me for my age and address and occupation, but not anything about, I was not expecting to be eligible. I was just seeing what it was asking me for. So I'm kind of curious how that app will sort of assess some of these factors. And then I was also wondering if you could explain to me what the state is looking at in terms of the non-congregate sheltering. The report seemed to say they're concerned about not having enough beds in Santa Fe and having to send some people to Albuquerque, but I'm not familiar with that. And then this is my last question. Why are the worst case forecasts for deaths in this week's modeling report so much worse for the start of February than they are for now? Okay, I'm finished. Thank you.
Okay, so Julie, I just want to let you know I wasn't multitasking because I thought everything you said was really important. So let me go backwards, and Secretary Collins can just jump in anytime she wants. February deaths, we talked about this, like an hour ago, but I think what Lanel is thinking is that every time we have a peak, then we have a valley, and then we have another peak. And so part of what they're thinking is with some maybe the vaccine will relax people's attention to distancing and masking and the like. So I think that's just a reflection of a later wave that they are thinking may come 6 weeks out, though, is really hard. One thing I've learned about modeling is it's pretty good to predict on the way down how far down you're going to go, and on the way up how far up you might go. It's not so good in transcending valleys and peaks. So we talked about that just a little bit today, but I wouldn't put too much stock in those February results until we see how we do through the holidays. I know the sheltering question, Secretary Blaylock is working on that full time, and it was just a what if sort of question today. They did say on the call that they were thinking that they probably will have that sheltering capacity in Santa Fe. But again, that would be another thing that remains to be seen. So that was more of a what if scenario. We have an awful lot of what if questions that happen in modeling, which is kind of the reason we have modeling, is to be able to ask and answer those things. And then the last question was sort of, what's the correlation between you signing up on the app and whether or not we'll be able to take a geographic approach to the pandemic? And so Secretary Collins will probably want to say a little bit about this. She spoke to it earlier. We still haven't decided further distribution of the vaccine. And so we're not committing to a geographic approach at this point in time at all. And in fact, there was a lot of back and forth about that today in terms of what is the best strategy for reducing deaths the most. And so I think those questions are still up in the air and being considered by DOH, but I know Secretary Collins does get to what are the second and third phases and how are we going to decide all of this. So I'll hand it to you.
So thank you. And the app right now, it certainly helps us work with 1A healthcare workers, but ultimately we'll be able, once we've defined where we're going to prioritize, this app will help us prioritize those groups and help people know when they're eligible for testing. So the information we're collecting will be used to help us. Once we have our list in place, we'll be able to use the app to direct the persons who've registered when they're eligible. So a lot of that information will be very helpful to us.
Thank you, everybody. Next, I'm going to turn to Matt Grubbs with New Mexico PBS. Go ahead, Matt.
Hi, Alex. Thanks very much. Dr. Scrase, Dr. Collins, thanks for doing this, of course, and happy holidays to you both. Dr. Scrase, I too was multitasking and signed up, so I think you may get a few of those. One of the things I'm wondering, though, is when will people sort of know what group they're in, what month they might be likely to get vaccinated? Is there a point at which you think you'll have enough information to give people a reliable indicator of how far away from a vaccine they might be? And then second question for either of you, a lot of people will be spending time outside during the holidays, and I'm just sort of wondering if you could run down sort of safety measures for outdoors. If you're skiing, is that safer than going for a walk with, socially distant neighbors, that sort of thing? Thanks.
Okay. Yeah, I'm going to just kick off really quickly and then turn it over to Tracy. I think there's two parts to the when will I know when I might get my vaccine. And I think the easier question is we can always figure out what everybody's place in line is going to be. I mean, that's what DOH is working on now. We're doing it with healthcare workers, but there'll be other groups, and sort of what is that general order, I think, is something we can do. But knowing the month depends on knowing the vaccine supply, and that's been sort of variable. So Tracy, why don't you talk about what you all are doing and thinking about in regards to that, lining folks up in the various phases?
Yes, currently we are in the planning phase of determining who's next in line as far as prioritizing. Certainly essential workers are in line, and we need to figure out how we sub-prioritize within those groups and do that equitably. Also, age 75 years and older is also in line with the essential workers. So we are in the planning phases now. We're going to have more information for the public in January as to which groups will go next. And so following up on David's comment, it really does matter what the supply of doses are as to who's next to receive that vaccine.
Yeah, and then Matt, thanks Tracy. And then on the outside activities, we do know that outside is better than inside. And you asked about skiing. We also know there were like massive outbreaks in ski resorts and much earlier this year in Austria and other places. And so I think if I were going to give people advice, it would just be beware of indoor parts of outdoor activities. So going up on a chairlift with a family member while skiing with a mask on is, that's probably going to end up being pretty safe. Riding in a gondola with 20 other people all crammed in, and some people wearing masks and some people not, on a 11-minute ride up a mountain, probably not safe. We have boys and they're really eager to go snowboarding, and so we've had a lot of these conversations at the dinner table. The other one is lunch. If you, these cafeteria settings at ski resorts, I mean, they really are crowded. And so, my tips for people who are going to do our outdoor activities, really, the number one rule is follow all the other rules you already know about distancing, masking, keeping your hands clean, and the like. And then secondly is really make plans in advance to avoid the indoor parts of outdoor activities. So I have another son in Michigan who's talking about a backpack that he's going to put his lunch in when if he goes skiing and things like that. But I think those would be the main things. You know, going around in a group and caroling with other people, you know, it is outdoors, so it's going to be safer than a choir practice indoors, but raising your voice, projecting is going to make that mass less effective and more likely to infect other people, even if you are outside. So in summary, do the things you know you're supposed to do anyway. Beware of inside parts of outdoor activities and make plans to avoid those. And I think that it's great that we live in a state where we can do outdoor things even at this time of year. Next.
Thanks, everybody. Next, I'm going to turn to Dan Boyd with the Albuquerque Journal. Dan, go ahead.
Yeah, can you hear me all right?
Yeah, Dan, but we need to know before you start whether you've already signed up on the app.
I have not. I was not multitasking at all. So I was listening to your every word intently.
Okay, thank goodness. Okay.
No, I may have. I've not signed up for the app yet, but I also appreciate both of your time this afternoon. Two quick questions. One, just kind of broadly, you kind of referenced maybe that we're at a halfway point of the pandemic. I think a lot of folks are ready for 2020 to be over and looking ahead to 2021. And I know you can't offer any predictions, but kind of your general thoughts on the year to come and how you see that kind of playing out. And then secondly, wanted to follow up on Matt's question on the vaccine. And I had read some about that maybe minors, those under 18, wouldn't be getting a COVID vaccine, but wanted to see if the state had any discussions at this point on that issue.
Well, I'm going to do the first one, and I'll let Secretary Collins do the second. And she can, and Tracy, please feel free to comment on the first one too. You know, I think the reason I said halfway is just there was a lot that came out in the fall from a lot of world experts thinking that typically if we really do everything to keep cases down and get as many people vaccinated as we can, that process could come to a conclusion, you know, late August, September, where some, but not all aspects of life could start up again. So I've kept that, like, I just have the September 30th number in my head, and it's not going to cheer you up that much, but it turns out that 2 days ago, December 20th was exactly halfway between March 11th, 2020 and September 30th, 2021. If we get out of this sooner, that would be great. I think next year we'll still be struggling with the trade-offs between what we know we need to do to prevent the spread of coronavirus and the increasing impatience folks have to be together more. I think the vaccine is going to be a critical component to this. I'm hoping that the early phases of the vaccine will have a significant effect on case counts, as many people think they will. But I think we still have a road ahead of us, and unless everyone just all of a sudden decided to adopt every COVID safe practice there was, you know, I'm concerned that there may well be other peaks ahead of us going forward. So I do see, though, I feel like there is kind of light at the end of the tunnel that isn't an oncoming train. It makes a difference to me emotionally to be halfway through this. I feel very, very relieved, although I'm hoping it's not temporary on the kind of bullet that we dodged in our hospitals by not having to ration care, but that was unbelievably close, you know, this time. And so I'm hoping we don't get back to that, but it all depends on us and what we decide to do and how we decide to approach it and whether we can stick with it for the last, whatever that would be, 13.1 miles of the marathon. Secretary Collins.
Yeah, I mean, we want to vaccinate as many people as possible. It's just the order of how we vaccinate really starts with the elderly, essential workers, and then those with chronic conditions, comorbidities. And so it's not that we're not going to vaccinate those younger than 18. It really depends on the vaccine and the availability of doses.
Great.
Thank you. Thank you, everyone. Next, I'm going to turn over to Robert Knott with the Santa Fe New Mexican. Robert, you should be able to ask your question.
Thank you. And as with the other media, I thank you for doing this. I also am going to try to get as many questions as I can in. So first one for Dr. Scrase, and then I have some questions about the home testing that either one of you can take. Are we seeing any evidence yet that the early vaccines, which just took place last week, I realized with healthcare, or that the color-coded plan to basically give counties a sense of where they stand with the virus, is there any early evidence saying that that's working right now in terms of numbers flattening or not being as high as they were? I'd like to hold on that one and then just come back if that's doable for some questions about the do-at-home kit, if that's okay.
Yeah, no, that's fine. And let me do that one first. No, the answer is no. There's no, we won't be able to link vaccination with, case rates probably till early mid-January, I'm guessing. We were already seeing a downward trend in cases before the vaccination started. And so, and 14,000 people is a lot of healthcare workers to vaccinate, but it's a relatively small percent of the New Mexico population. I'm kind of thinking that for each 10% of our population that we get vaccinated, which is 210,000 people, we will be able to notice incremental change and improvement, but we just don't know that yet. And but we're watching for it. I would give credit for all the downward trends in counties that are going on right now, to the reset that we did and to the people's wise choices over Thanksgiving, and probably deep concern for loved ones and friends who are healthcare workers as well. So I feel like for now, we won't really know that for a bit, and we'll need to see a bigger percent of people vaccinated before we can, that'll really show up on our radar in case counts, I believe. I don't know. Tracy, do you have another view on that?
I mean, I agree with you. I certainly think we need to get through several people having 2 doses. And so looking at that and the number, we're probably looking at the latter part of January. I'm thinking more February before we begin to see the impact on the pandemic.
Thank you. Can I go ahead with the home test kit questions?
Alex has not kicked you out of the press conference, so apparently you can.
Even with my dog barking behind me. Thank you, Alex. Again, multi-questions, and I can repeat. I'm curious, how much access will we have to this vault do-it-yourself test? Is it unlimited right now? What do you think the demand will be? Are there any limits to how often we can request it if we wait every 2 weeks and want to do it again? And I'm curious if there's been an immediate surge today. Are we paying attention since the news came out? And again, I can repeat any of those.
Yeah, so I can start on that one, David. It would be unlimited, and we really will have to track demand. And we have not had a chance to look at if there's been a surge of requests. I mean, it was just started today, but we'll keep our eye on that over the next few days, and we can have more information later.
Yeah, I would just throw in there too that we've talked about this for months, that this whole waiting and going to a giant testing center at 1 a.m. to get your place in line and having someone do the nasopharyngeal swab while you're in your car. I think we're seeing those wane. And I think this home testing, more convenient testing, saliva testing, we have a ton of medical evidence that it should be just as effective. And I think, as a physician, there are a lot of people who are reluctant to do things that involve procedures or things put up their nose. So we're really hoping that this will be something that New Mexico will welcome, and we'll get our testing up to to high enough levels to bring our positivity rate back down to 5% and keep it there.
Thank you, everybody. Next, I'm going to turn over to Grace Reeder with KOB. Grace, go ahead.
All right. Again, thank you so much for your time. I have 2 questions. Dr. Collins, could you tell us, if you know offhand, how many vaccines intended for New Mexicans didn't actually make it to people's arms because of temperature issues, transportation issues, any of those things? And then Dr. Scrase, you talked about getting out of crisis care as of this morning. Many of us are lucky enough not to know firsthand what the inside of our hospitals look like right now. Could you kind of give us an idea of what kind of pressure that downgrade takes off of staff and patients? But you also kind of had that addendum about 2 weeks in there. Do you have any additional comments on not getting too excited about that movement?
Okay, well, I'll go ahead and start. Of the actual initial dose of more than 17,000 doses from Pfizer, we had one shipment, so 75 doses, where there was a concern that there was a temperature deviation. And for safety concerns, we decided not to use that shipment. But that's the only shipment that we've lost because of temperature or transportation.
Yeah, and I would add that our bigger hospitals tell us this morning that they've wasted 0 doses. So that's good news. And in fact, are extracting that 6th dose and occasionally a 7th dose if there's a full dose in there out of the vials we have. So that's good. I think on hospitals, I'm going to start feeling better when hospitals get down to just being full and not being at 120% of full. I think that the people who work in the hospitals are going to feel better, like they notice the difference. They don't have 50 people in the, we don't have 50 people in the state waiting in the emergency room for a day or longer because there's not a bed to put them in. I would remind you that in the Northwest, they're still up against it big time. And so that it is not abated there. And the crisis standards of care, remember, are just when we have more demand for services than we can supply. And that's when we have to that the demand is going up. So when we're in crisis standards of care, it's sort of our last opportunity to do everything we can to increase our ability to provide care so we're not overwhelmed. And our folks in hospitals across the state did an amazing job with that, expanded to take in this 120% of normal volume and handle that. So I think I'd like to see ICUs at less than 100%, down below 290 people. I'd like to see hospitals with at least 10% of general beds open. Remember they run at 60 or 70. I'd like to hear stories about staff finally getting a vacation or getting to take that time off they've been asking for. Don't stop supporting our healthcare workers. They're still doing an amazing job and it's still real tough. Next question.
Thank you, Grace. So this is our final question from Jamie Newton with the Gila Mimbres Community Radio in Silver City. Jamie, you should be able to ask your question. Jamie, you may need to unmute your device to ask your question.
Thank you. I thought you were in control, Alex. Thank you so much, both of you, for all the work you're doing and for speaking to the public through us. Early in the pandemic, February or March, Dr. Jonathan Smith, who's an epidemiologist at Yale University, published a cautionary statement that's been very widely circulated. He warned that a small percentage of a population can undermine widespread, consistent precautions by the majority. And the result of that is costly disruption with very little gain. So, can you say whether you're concerned that enough New Mexicans will decline vaccinations, refuse to wear masks, hold gatherings with close social contact, enough to significantly lengthen the tragedy of the pandemic despite your efforts and compliance by so many people in the public? Thanks so much for taking the question.
Yeah, I'll start and then hand it off to you, Tracy. I think every person who does what needs to be done helps a little bit. And the trouble is it's an incremental thing. And so they might not feel that or know that. Conversely, folks who don't do that, stuff may hurt a little as well. And so we do know that masks protect people who wear them from people who don't. And so And we do know that there are outbreaks of coronavirus in summer camps and choir practices and those sorts of things. But a lot of that happened a while ago. And I think the public is more educated. People are more educated about avoiding folks that they think might spread the disease. I don't personally feel like we're in a situation where 2% of the population can ruin it for everybody, but I do think there would be a difference if between 60% of people following all the public health orders and 80%. So I'd soften that kind of giant lever that a small group of people would potentially have to do harm and just sort of counter it with the majority of people doing good, doing the right things to do good. And so that's just sort of how I think about it. I think it's much bigger percents than that. And I think we're all getting smarter about, I had some work done on my house a while ago, and some of the work people needed to come inside, and one of them had a mask with a vent, and I was taking people's temperatures, and I had my mask on, and he didn't get to come in with the mask with the vent. And so I think as we go, we're learning, we're getting smarter, and as, if you will, a herd, we're doing those safe practices that keep us safe until we get the vaccine to make us immune. Secretary Collins, what do you think?
I think that New Mexico overall has been a role model for the country. We ran into the surge as people began to get tired of COVID, but I think in this state, we're not going to see the numbers of people who would undermine what's good practice. I think we're in a good position in the state. I'm very proud of the Mexicans.
Thanks. And we do actually have one more question. Robert has raised, from the Santa Fe, New Mexican, he's raised his hand one more time. So since we have a few extra minutes, I'm just going to permit him to ask a question.
Thank you. It's about the home testing one more time. Dr. Scrase said that hopefully, as reluctant as we are to stick something up our noses, that, it could bring testing levels up enough to bring the positivity rate down. And as much as I've sat in on all of these sessions, which I appreciate, it's still like you'd explain how that would work. How would home testing help us bring positivity rates down, please? And thank you for the extra time.
Okay, great question, and delighted that Alex let you in for one more question. That's good. Just let's start with the fraction, just to review. The top number is the number of actual cases, and so if somebody gets 20 positive tests, that counts as one, and they get one positive test, it counts as one. They're one case. And the bottom number is the number of tests done in that time period. We do a 7-day rolling average of both numbers and then divide them into each other to get it. So initially, it's true that if you have a test positivity rate of 15%, which is way out of bounds, we tend to believe that anything over 5% means there are a lot more cases out there than we're detecting. But let's say it's 15%. If you significantly increase the number of people tested, you're still going to find some positive results. But typically, people who are coming for testing have symptoms or are sick in some way, not always, but often. Some of it's surveillance testing. And so the more testing you do, the lower that positivity rate is. And so you're adding less cases to the top number and a lot more cases to the bottom number, which makes that fraction smaller and smaller and smaller as time goes on. It's not perfect because if you're in an area with widespread coronavirus and a very high test positivity rate, we were up in 25% in some areas last month. More testing will initially find more cases, but then this is the really important part. When you find those cases, you make sure if we get it, we isolate for 14 days total. Usually it's 10 days after the start of your symptoms. So if you're a case, you isolate for 10 days. If you're a contact of a case, you isolate for 14 days, 4 days that it takes to get the disease, and then the 10 more days. And so that's really why it works. The more cases you identify, the more people you can isolate, the more of their contacts you can identify and quarantine them. And then so even if cases went up a little bit, you're going to quickly find those people who may be spreading it to others that you don't know about, and that's going to push the curve back down. And so that's the idea. And I think that helped a little bit, actually. I think that was a factor in pushing case counts down in November, as in early December, as we were able to contact trace, isolate so many cases and quarantine so many contacts. So it's an important concept. It's sort of at the center of managing that pandemic until we have the vaccine. And so I appreciate you asking it. Is that it, Alex, for questions?
We have one more question, Secretaries Scrase and Collins. I'm going to turn over to Julia Goldberg again from the Santa Fe Reporter. Julia, go ahead.
Thanks, Alex. Thank you so much, Dr. Scrase and Dr. Collins. I'm sorry, this will be quick. Just as a follow-up, I understand about the test positivity rate, but I meant to ask, will the home testings, will you be able to roll both the number of tests and the test positivity rate into the gating criteria website, given the kind of different mechanism of people mailing and waiting for results? I wasn't sure if that worked with the daily updating that you've been doing on that, or the 3 times weekly updating you've been doing. Thank you so much.
Yeah, the answer is yes, we will. Remember, there's a public health order requiring any lab in state or out of state to report all coronavirus test results to the state. The new order requires it be done electronically. I just looked earlier, and we have, I think, already 30 to 40,000 tests from Curative, which is an out-of-state lab. Those are flowing in nicely in an automated way into our system. And so the Vault, under contract, is obligated to do that, and under state regulations is obligated to do that. So we're counting on having that data in real time. The other thing is that the labs we're working with we're ensuring that they have rapid turnaround time, so we don't get a long lag period that might not give us a full picture of what's going on every day. But that's built in, and Courtney Kirster, who works in the governor's office in Washington, got this set up in a way that will ensure that information flows quite nicely. So we're excited about that as well. And with that, then, I want to wish you all a wonderful holiday. I'm actually taking a little time off myself to just hunker down and have my cell phone off and not do email for a bit. But we really appreciate all you have done, and the press in particular, with the people of New Mexico, to get the word out, to provide objective, clear information to people, to reproduce the data exactly, to challenge us. And I've already told Dr. Collins this, but a lot of questions you all have asked have really resulted in some of the systems we have in place today. And so we think this interchange and interaction between the media and the public sector and the private sector as well has been really important. But hoping that you all too get a little bit of rest. Hopefully this downturn in cases will give you 3 or 4 or 5 slow news days to rest up and spend time with your immediate family, the people you live with, and that you'll stay safe over the holidays. I want to thank everyone on behalf of the governor as well, who's getting a little bit of that rest time herself, and wish you all the best. And I do look forward to some sort of giant celebration at the end of the pandemic, which I still am predicting will occur in 2021, just not exactly sure what day. And I don't know if you have any closing remarks, Tracy, that you'd like to make.
No, I want to wish everyone a happy holiday and to be safe. And we'll see you very soon in the new year. Thank you.
Take care, everyone.
Thank you.
Bye-bye.